Hi, there's a curse attributed to the Chinese when you live in interesting times. This is certainly the case for many actors in healthcare today. This is Dr. Demet. He's an oncologist, and together with his team, he's facing increased complexity in treatments, a higher and higher demand for personalization, and a game that is changing due to governments and payers. Hi, my name is Thomas, and I'm from Awell, and we are offering a platform to personalize disease management at scale. In our platform, our care teams set up pathways and track them and optimize them over time. So, healthcare, for all its benefits, saving millions of lives, it turns out it has been organized all wrong all the time. Today, it's still being organized in silos, and tomorrow we are going to organize healthcare in care pathways. The silos are optimized for revenues, the pathways are optimized for value. But Dr. Demet, as an oncologist, asked himself, how can I optimize my system? How can I optimize my care pathway for lung cancer? Well, as it turns out, this problem has been solved before. In the 50s, William Deming introduced the PDCA into Japan and made it into a production powerhouse. It didn't just change Japan, it changed the way business was done. More recently, Atlassian launched Jira, an immensely successful software product, and didn't just change how software was developed, but also how teams are working together. We are taking the legacy of these evolutions and applying it to clinical practice by offering a platform that allows to evolve care pathways more easily. Concretely, when our teams are setting up care pathways inside Awell and using them, our teams today, they say it feels like an additional colleague that is doing work for them. We are integrated seamlessly with local applications. Our system, contrary to a lot of tools on the market, allow for high variability care as well, and is also highly automated. Care pathways can be adapted and personalized on the fly, and we drive value. That means we can also create a view on cost and not just outcomes. And our current pathway library already spans domains like lung cancer, prostate cancer, IBD, chronic pain, orthopedics, and many more. So we are currently still unfunded. We started half 2016, and we have not only built a product, we have also built our company to scale. We have a global team that allows us to do remote implementations. We currently have 10 clients in multiple regions, one of them being Vande Hospital, which is one of the largest hospitals here in Barcelona. All our customers that are already using our platform are increasing their contract sizes, and we have a very strong pipeline. This is a view of our team. We have partners already selling our platform into the markets to hospitals, and we have very good advisors that are guiding us. So we see this as a once-in-a-generations opportunity. This opportunity is actually convergent for both traditional healthcare providers and also for the industry. This opportunity is about actual disease management, but letting it evolve over time. In the right column, you see some of the key figures that these markets represent today, and we believe that a big part of how this money is spent is set to be disrupted by tools like ours, just by reorganizing the care in the future. So we have passed the startup phase, the first 2 years, and are now ready for growth. We are looking for a 1 million seed round to help us do that. This will go mainly to accelerating our sales, both to hospitals, key hospitals and pharma, and there is a non-dilutive grant of 250,000 euros following later this year. Tomorrow we're giving a demo. I have not shown a lot about our product, but tomorrow we give a live demo, so you can join us or fill in your details and we will get in touch. Thank you.
All right, thank you so much.
Are you starting with some indications? I mean, you segment the care. What are, in your opinion, the most profitable segments that you would address, or you're doing like a wide shoot at the marketplace?
So what we see is that hospitals, they are looking for solutions to tackle this, and within each hospital, the departments that are ready to create their pathways, that have already thought about it and exist on paper in flowcharts that want to digitize it, they differ per hospital. And we see that obviously things like orthopedics, which are really low variability, are low-hanging fruit, but in other hospitals this is the really high variability, things like cancer and like IBD, for example. So we are actually going where the hospitals take us, and thanks to the flexibility of our system, setting up these pathways is really easy and low cost for them. So it doesn't matter where they want to start.
And are you selling directly to the hospitals, or you have a distribution partner that sells for you?
So we sold directly for the first year and a half, and we have started within that year and a half to look for partners, and you saw it quickly on the slide. We have a Spanish partner who sold to Vande, for example, which we have a partner in Brazil who sold to one of the largest orthopedics clinics in Sao Paulo. And so going forward, we will sell directly to pharma companies because we know that they are looking for value solutions to offer to their customers, and going to key hospitals, but all the others we are going to target through partners.
How do you, is it because you're still building the product, and you're already selling through partners, don't you miss the communication with your customers to get feedback in terms of how to improve the product?
No, so the product is live, and we have dozens of pathways live that are being used every day with patients. So.
How much time do you need between the closing of the contract and the actual rollout and start of use of the solution internally, so that comprises then implementation but also customization of the product?
So we won a hackathon end of December where we did a full pathway for scar tissue management in 48 hours together with the team. Obviously that wasn't implemented and integrated within. But let's say that it can take anywhere from 2 weeks to 3 to 4 months, and that's mainly based on the speed that the hospital can take.
Following the question, which is the customer acquisition cost, and if you can complete a little, what are you doing for Vande in this case, which is the task you're developing?
Okay, for Vande we are setting up a stroke pathway, so at this time to track stroke outcomes, and in the future will help them to optimize their care pathway for stroke. In terms of acquisition cost, it's meeting these people. We can do this over teleconference or physically, obviously. But that's basically it. So we just have meetings, we have demos, and let's say that we have on average 4 to 5 demos. First it's with clinical people, then with direction, before we move towards a contract and then agreement in a contract.
So it seems that you have quite a healthy number of clients already. So how do you see growing the revenues within those existing clients?
So our very first hospitals all doubled their contract size and have already expressed that they would like to roll this out over their full organization in the coming years. This is part of the challenge we would like to tackle now in the coming growth phase. We have hospitals that have 3-4 departments live, but we want obviously to capture the full value within each of these hospitals, which is, we estimate 70 to 80% of all the patients that are eligible to be treated with care pathways.
Time for one last question.
When do you see an exit happening, and what will be the trigger? And if you could, will it be a consulting company like BCG or McKinsey, or who do you see as a potential acquirer?
So we obviously intend to build a lasting franchise and be on the stock exchange forever. We do not wish at this moment to be acquired. Why? Because we see that this opportunity is so large. There are a lot of positive feedback loops baked into the product, so this is actually every pathway that is available in our library can be reused, so that means new teams using it, adapting it, new patient populations, which again leads to new pathways, etc. So we want to fully maximize these positive feedback loops and postpone an acquisition as late as possible. So But if I have to answer your question, who would buy us? We can potentially see pharma companies buying us. If within our library there is enough overlap with the medication or the drugs that they are offering, or if they want to move outside of the drugs that they are offering and offer more the value solutions that they're currently after. We see that, for example, Philips bought Vital Health, which is more or less in the same space as us. So that's a potential possibility. So.
All right, thank you.
Thank you.